Hello, I'm Dr. Kiran, Senior Orthopedic Surgeon, Subspecialties Spine Surgeries and Rheumatology. Preventive Orthopedics. What is preventive orthopedics? As an orthopedic surgeon, when we see a patient, a small child, there is an imminent problem, we have to immediately counsel the parents and intervene then and there. Such a topic here is Osgood Schlatters disease. Now, Osgood Schlatters disease, Osgood and Schlatter, are they two persons or one person? Osgood Schlatters disease, is it a disease? Why am I bringing it into the topic of preventive orthopedics? What is the relationship? What are the chances of a patient with Osgood Schlatters disease to have high riding patella, patella alta? Low lying patella is called as patella baja. High riding patella is called as patella alta. I wish to discuss this topic as a story, a narrative story of a boy of around 15, 16 years age group. So I'll begin here. This boy was a captain of his wing and he was very active in basketball, football, cricket, running, high jumps, everything. One day he went to his father and said, "Father, I have pain in my knee." He said, No, it'll go. "No, Daddy, it's not going. It's there since a long time. I didn't tell you. Now I'm telling you." He asks, "What happened?" "I am jumping and I'm doing everything. Nowadays I'm getting pain in the knee." "Is it both knees?" Not much in the right knee, but left it is more, Daddy." "Okay. So show me." Father sees the knee. He notices a swelling, redness, and a little prominence where its location is not in the knee joint, a little below. So anterior or anteromedial, upper part of the leg. So he says, "I will apply ice," because routinely that is what is done. You remember that sportsman fell in the game of cricket, and you remember one person running with two boxes and putting it? The boy says, "Yes, Dad, that's ice." "Correct. So I'm going to apply ice for you. We'll wait for 1 or 2 days. If it doesn't come down, with paracetamol syrup which I have, or brufen, whatever will help you. After 2 days, we'll go to the orthopedic surgeon." After 4 days, the pain comes down. The boy again resumes his activities, and after maybe 1 month, he's again back to his active sports. And one day he again returns back to the father and says, "Dad, it's troubling me, Dad." Then he says, "No, let's go to the orthopedic surgeon." Here, I would like to show you two scenarios. Orthopedic surgeon 1, orthopedic surgeon 2. We remember saying, "The eyes do not see what the mind does not know." I see something. Unless I know that this is a stick, a pointer, whatever you call, unless I know the purpose, I will not be able to interpret it properly. I'll just say it's just a wooden piece and I'll throw it off. But of a person who understands the importance of this, he can point, he can show, he can emphasize, he can do a lot of things with this. So, eyes do not see what the mind does not know. The boy is taken to orthopedic 1. First ortho doctor sees him clinically, examines and says, "Nothing, it's just a growing up problem. It will come down on its own. It's called as Osgood Schlatters disease." So the father wants to ask more, and the busy doctor, Ortho 1, says, "It's just Osgood Schlatters disease. So X-ray I will do." He does the X-ray and he says, "Yeah, see these secondary ossification centers, they are not fused yet. So there's a little pressure on the site of the tibial tuberosity and it's showing a little elevation. That's the reason why there is prominence. Give him rest. Do not allow him to the sports for some months or years. That will settle his problem." They go back. The boy goes back, takes rest, puts a kneecap, all the routine things. He follows the Ortho 1 doctor. After 3-4 months, he again gets severe pain, this time with swelling and real hot tenderness when it touched, and it's very tender. So when he's touching, he feels the pain. He can't kneel down. Its pain is increasing. So he goes back to the father and father takes him to the second doctor, Ortho 2nd doctor. This doctor reviews the first X-ray done by the first Ortho 1 doctor, and then he is closely measuring some lengths on the X-ray. So the father asks, sir, what are you doing? No, I'm just making some measurements because I think your son has Osgood Schlatters disease. Agreed. Sir, is this a disease like any other disease, like many diseases like malaria, tuberculosis or anything, infection? No, it is not infection. It is Osgood Schlatters disease is a self-limited disease. Once you give rest, it will come down. Mostly it will come down. Then the father will ask, sir, you said mostly. What do you mean? Maybe it will not unite? He says, yes, there is a chance that if the lifted secondary ossification center is not united, it may remain painful even after skeletal maturity. Then the father will say, sir, I am not understanding, sir. What is ossification center? What is skeletal maturity? The second doctor says, don't worry. There's some communication gap because of the language difference between the patient or the attendant who is of non-medical backgrounds and we. So our language differs, but I will tell you in a normal language as far as I can. And if you have any problem, please let me know. He says, I'm very grateful to you, doctor. Please let me know. Then he starts explaining, saying that God is the greatest sculptor, is the greatest engineer, like any sand clay or clay sculptor who puts first a rod on which he starts applying molds of small clay pieces and then extending and developing the sculpture. He does the same thing to our human body. We have a primary skeleton with primary ossification centers. The first basic skeleton support is primary ossification center. Sometimes they are there when we are born. Rarely there will be one or two which will appear a little later. But after certain time, at each stage of life, for example, at 4 years, one secondary ossification center, just a piece of clay appears. Then again appears later, like at 1 year, 1.5 years it appears. They all must become one and they should unite at the time of skeletal maturity, which usually in the females is at around 16 to 18 years and 18 to 22 years in a male child. Father understands. Okay, doctor. So what is this problem? Then the Ortho 2 doctor tells him the upper end of the tibia, where when there is lot of pull, this is the patellar tendon into my upper end of the tibia, the secondary ossification centers form a apophysis. Tuberosity or this whole region is being pulled by the patellar tendon connecting the patella and the tibial tuberosity. And very powerful pull on the tibial tuberosity area where these secondary ossification centers are pulled up. So that is the reason for the swelling which we see, which may become permanent forever in life, for example, or they may cause also some growth problems, the deformities of the knee. Why is it occurring, doctor? Then he answers, see, this abnormal pull may be due to various reasons. I am measuring the insal ratio. I am measuring the patellar length and the patellar height because in my view, your boy has a high patella called as patella alta. Then the father says, what is it, sir? He says, normal patella is this. Now patella alta, high riding patella is this. Now you can also have patella baja, which is like this, a low lying patella. All these alta or baja varieties, upper or lower positioning of the patella by birth can result in osteoarthritis, softening of the cartilage, patellar tracking problems and many more problems of the knee as the child grows up. One more thing, sir, the father says, my son sometimes has pain in the upper part of the knee and he sometimes complains that his patella is moving abnormally, abnormal mobility with pain. So by now, the second orthopedic surgeon already has clinically examined the boy. He said, yes, there is a lateral abnormal mobility present. Also, he has apprehension test positive. He says when the patella is being forced outside, the boy is stopping my hand so that I don't push it out. Meaning there is a weakness, lateral instability because the articulation is not, if you see this, my knuckle has a trochlea, a notch. The patella is not sitting here. Patella is sitting like this, upper side. So it has no restrainer. Here there is a restrainer. It is restrained. It doesn't go medially or laterally. It stays in the center. Here, when it is here, it's on the bone. So it can go like this, like this. He says it's an inherent instability that is present in the patellar tracking. So the patella can also become painful under surface because it's leading to a softening of the cartilage, 1. 2, then the father stops. Sir, the boy also has pain while getting down the stairs. He says yes. One of the facets are more traumatized. That's one of the surfaces of the patella. The small bone, which is a sesamoid bone, which can develop in the quadriceps expansion. And it increases the mechanical efficiency. But when it is high or low, it loses the patellar tracking efficiency and leads to degenerative changes. So the father is now very happy that he is getting full knowledge from the Ortho 2 doctor and says, sir, what is the treatment? Do you want to do a surgery? Ortho 2 doctor looks at him and is very happy that father wants it to be corrected. Okay, he jumped to a conclusion that surgery would help him. He says, yes, surgery, yes, I will do. But before that, I want to keep surgery as the last option. First option must be physiotherapy. So the father asks him, sir, why sir? You won't do surgery? He says, it's not that I won't do. I will do. It will be the last option because he has open epiphysis. Growth plates are called epiphyseal growth plates. When we do any surgery around that area, if there is any early fusion, that will lead to, in the front of the knee, there is no growth, and behind, posteriorly, there will be growth. So more length posteriorly than the knee is like this, it becomes like this. We call it genu recurvatum. These deformities can form if something goes wrong, or if you put any screws or any pegs or staples. We have to unite the unfused secondary ossification centers. They have their own problems. So without surgery, let's do physiotherapy, where in the literature it's documented that they can be also helpful. They will give strapping and many other techniques so that you will have very good relief. If physiotherapy fails, then let's think about surgery, where I will do the patellar insertion. The tibial tuberosity will be cut and shifted little distally so that the patella will come down. So he also explains, if it's just a plain Osgood Schlatters disease, this is not needed. We will just needle it and put some bone grafts and fix it. And if it's an unfused secondary ossification center, we can fix it after a graft with screws or staples, whatever that is available at that time. Because as with years go on, new techniques come. Use physiotherapy, he may not need a surgery, and it is a self-limited disease. So take care of his vitamin D, calcium intake, his supplements, blood tests if required, do it. See that he is fit, but avoid strenuous exercises. That's all for now, he says, and everybody is happy. I'm talking about patella. Patella here, as we can see in the long axis, it's more lateralized. Here also it is lateralized. Now when we draw a line along in this intercondylar line, it should pass through the lower third of the patella. So when I pass like this, the patella is not even touching this line. So this is called as a high patella, patella alta. If this patella is down somewhere here, it is patella baja. So the normal patella, this line will cross like this. So this is high riding patella. This will lead to osteoarthritis and chondromalacia patellae. Both the right and left are same. They are high riding. So as you can see, this will cause friction on this upper part of the condyle and lead to osteoarthritis due to wear and tear. She already has 3 episodes of lateral patellar dislocation. At this stage, I want to close this topic, and I await an interview with a good physiotherapist whom I know here, and I'm going to ask him what are his results, and that will be the continuation upload, video upload from this. Thank you. Good day. Bye-bye.